Hey, what's going on, everybody? I am back with another video. I know I have been MIA lately. Blame it on the pregnancy 100% because your girl has been tired. I have not been feeling like doing anything, to be completely honest. In this video, I'm skipping over week 33. We're just going to get into week 34 and week 35. I don't really have that much to say about the symptoms. Honestly, it is mainly me being exhausted. Everything else is kind of the same as the last videos, but I am definitely feeling those, or the third trimester woes at this point. I'm starting to get the waddle, I mean everything. And actually, as of today, I have hit week 3, 6. Guys, we're almost to the finish line. But I want to go ahead and let you know what's been going on. I had my baby shower a couple of weeks ago. So much fun. I just want to thank my girls once again. They did an amazing job. The decorations were gorgeous. I mean, I had friends and family who were able to attend virtually. I appreciate that so much. I mean, it was awesome. Like, we had such a good time. It was great. So as you can see on the pictures that I posted on here, we just loved it so much. So I was gonna do a video while at the baby shower, but that didn't turn out, wasn't able to do that. So I want to get into some other things concerning my pregnancy. So in the title, I have chronic high blood pressure. I've told you guys about that previously, and I want to just expand upon that right now. So I have been taking medication for high blood pressure since I was 6 weeks pregnant. I have been dealing with high blood pressure on and off since the end of 2018. However, I was able to manage it with a vegan diet and exercise. Well, when I got pregnant, and before I got pregnant actually, my diet changed to vegetarian. We had moved, so it was just all over the place. I could not maintain that strict vegan diet, nor did I maintain working out. So once I got pregnant, it just kind of all went out the window. So I didn't want to be on medication for so long, but because I was pregnant, I wanted to protect myself and my baby. So I went ahead, accepted the medication, been on it ever since. Things have been going well. I haven't had any issues with my blood pressure. Only when I'm at the doctor. I do have white coat syndrome, but honestly, they are able to get a normal reading when I'm there, so it's not that serious. The times that they may have felt that it was a little elevated, they have run some tests and things have been fine. So I've talked about that before, but I wanted to bring it up today because I've been going in every week since about 32 weeks to get a biophysical profile, and also the non-stress test, which I think I talked about in another video. But I want to explain what the biophysical profile is for those of you who don't know. So with the biophysical profile, they are testing 5 things for the baby, okay? And they're doing this for me because of the high blood pressure. Even though my readings have been normal at home and at the doctor's office, because I am on medication, they do want to make sure it doesn't spike, towards the end of the pregnancy, because that is known to happen. Some women who haven't had any issues with high blood pressure, of course, they develop high blood pressure towards the end, and which is preeclampsia. So because I already suffer from high blood pressure, it's more of a risk, okay, for preeclampsia. So definitely understandable. So I want to get into the 5 things that they test when they do the biophysical profile. And this is through either a non-stress test or the ultrasound. So what they test first is the fetal heart rate. They want to make sure that the heart rate is in line for the gestational age of the baby. Then they test the fetal breathing. So they test to see how she's breathing, the rhythm of her breaths, I believe, as well, the fetal movement. So of course they can test that with a non-stress test, but they are also able to see that through the ultrasound. Number 4 is the fetal tone. Not exactly sure what that is. And then they test your amniotic fluid volume. So they want to make sure that your amniotic fluid is in line with where you are in your pregnancy. At this point, we're not creating any more amniotic fluid. So, you know, at this point, the baby is ingesting the amniotic fluid, but you're not, there's no more coming in, if I'm not mistaken. So they just want to make sure that everything is still fine with that. My baby girl, she has been passing her test with flying colors. She is absolutely perfect at every visit. But again, just because she's doing well 1 week doesn't mean things can't change. So that's why they do these tests. And like I said in the last video, I absolutely appreciate what they have been doing for my baby and I. Of course, with that, they test my blood pressure every time I come in there to make sure it is normal. At my last visit, they did say, as long as I'm good, they're not going to worry about inducing me prior to my due date. They'll continue to allow me to ride it out and hopefully go into labor on my own. So that is what I'm hoping and praying for. I don't want to be induced. I want a 100% unmedicated birth. I'm trying to follow in the footsteps of my mom, I guess, because for 4 out of 5 of her kids, we were unmedicated. So, or she had an unmedicated birth. So I would like to try it out. I'm actually looking forward to going through labor and delivery. I'm looking forward to experiencing it, experiencing the pains and the discomfort and, you know, everything that goes along with it. It's just been a dream of mine to be pregnant. So to actually be able to experience pregnancy, and then I'm getting closer to labor and delivery, I can't wait, to be honest. You know, being pregnant has had its ups and downs, mainly ups for me, which I am so thankful for. So it's not about me being tired of being pregnant. I'm just really ready to meet my baby girl. So, but yeah, I don't want to keep this video too long, but I wanted to just share with you guys, you know, what I'm going through as far as, you know, going into the doctor every single week and why I have to do that. So those of you other moms who suffer from chronic high blood pressure, it is not anything that you have to be so concerned about. Just make sure you're doing what you're supposed to do, taking your medication. I've been taking baby aspirin for the last, I think since 16 weeks. So I take that every night. That is supposed to be a preventative measure. There's some research to that. So I've been taking that and just having a great doctor, a doctor's office who really cares about me. That's also very, very important. So yeah, I just wanted to come on here, let you guys know all about my journey with the blood pressure and the biophysical profile that I have to get done for my daughter. And also I have an appointment coming up this week, and they will be testing her growth, her weight, making sure that she is in line with the 36 weeks. And I'm very confident that she is going to pass that test with flying colors as well. She moves a lot. She loves being up in the middle of the night. When I get up 5 times during the night to use the restroom, she's wide awake. So you know, but we're just really excited to have her here. And yeah, I mean, that's pretty much it. I don't really have anything else to say. But yeah, I really feel good for the most part, with the exception of being tired at times, but been feeling good, feeling great, ready for the big day. It can happen anytime soon. So just continue to stay tuned, guys. I'm gonna do another video to update you guys on how our growth scan went. And just stay tuned. Remember to like, share, and subscribe. And I will check in with you guys in the next video. Bye.